This webinar is about respite care being so important. So many of our caregivers are not professionals. They are family members. And so that's why we're bringing you this webinar. We are age-wise, Colorado. If a friend told you about joining us today, we hope you'll take a look at our website. We're here to help older adults and their caregivers. We ask everyone to please mute and turn off your camera as we are recording. We'll post this on the website so that others can benefit from what we learned today. If you have a question, just raise your hand and you can unmute and we'll do it that way. We've had a little change today in our format in that one of our presenters is joining us a little late. We do ask you always consider possibly making a contribution or volunteering because we run on all volunteers and we feel we're providing a really important service. So today we have Katie Hargrove with us. And a little later, Derek Williams will be joining us. I'm not going to read their bios. You can see them later. And Katie, if you would in the chat put your email, if anyone wants it right away, that would be helpful. So again, visit our website early and often. And with that, we'll just turn it over to you, Katie, and I will stop the share.
All right. How is everyone this morning? Good, I hope. Or is it almost afternoon? Okay, I just put my email in the chat. So if anybody has questions afterwards, want to have longer conversation, you know how to get a hold of me. So I am with All the Comfort of Home. We provide non-medical home care services to folks in the Denver metro area. But we are here to talk about respite care. Respite care is temporary relief for anybody who is being the main caregiver for a loved one. And typically those are folks who are at home caring for a loved one. The unpaid person, the 24/7 person, typically the spouse or an adult child whose parent lives with them or vice versa and doesn't necessarily get a break or, works from home and does the caregiving in conjunction with still working. So anybody who is the main caregiver, obviously we all know that's not only a very hard physical task, but it's mentally, emotionally, it's a wear and tear on your body all around. So services like ours, and there's a ton throughout the Denver metro area, do offer respite care services. So if it is, once a week, you need a break because you just want to go to the grocery store and not have to worry about your loved one at home, we can provide services like that. If it's, once a month to go to a doctor's appointment or just go out on a walk so you can truly, truly take a break, we can do things like that. I'm going to try and share real quick. So I can have Barbara send this out after to everybody, but here's a long list of services that all non-medical home care agencies in the Denver metro area can provide. There's personal hygiene, activities of daily living, dementia care, nutrition, environmental needs, medication reminders, transportation, companionship, all those sorts of things. So with that, nothing that you initially go in, you have a conversation with somebody about, that never has to be something that's set in stone. So you can always grow, adapt. If initially it is, simply companionship, say for a loved one who might have a tendency to want to wander, and you just truly do want to go to the grocery store without having to worry, or to a doctor's appointment or something to that sort, we can provide those services. And as your loved one ages, their care changes, care needs increase, we can also adapt to that. So if it becomes more than just companionship, and you're needing some help or wanting help with maybe more of the personal care tasks, some, shower assistance or dressing assistance, things like that, most agencies like ours do and can adapt with the changing need of your loved one. It's very, very movable, because people don't stay the same, care never stays the same, and it's very adaptable to what's needed. Before I keep talking, because I can talk a lot about this, are there any initial questions about care that's provided? How to find a good agency, what questions to ask, that sort of thing?
Katie, I have a question. First of all, anyone can find lots of home care agencies on their
Mm-hmm.
website. I have to give us a plug.
Yes.
But the other question would be, is there a minimum amount of time? Like if I needed to go somewhere for an hour and a half, is that okay? Or I know a lot of agencies charge, you have to have X number of hours as a minimum.
Yes. So that is rare that an hour and a half, 2 hours is something a home care agency would do, but it does vary agency by agency. There are definitely some folks who do it. Just keep in mind there is an upcharge for less than the 4 hours. That's pretty common theme in home care right now. Um, but yes,
You would pay more for an hour and a half per hour.
per hour,
Yeah.
yes, than you would for a 4 hour shift.
Per hour.
Exactly. Along with that, too, when you are looking for a home care agency to help out, and you're asking, what are your minimums? Is this something, you're willing to negotiate on? You also want to make sure that you're asking what the cancellation period is, too, because like our agency, we only have a 24-hour notice. And if we know, hey, it's just going to be once a month, and we have that conversation up front, then great. But if it's just, there's other agencies in the fine print of the agreement that you'll sign. There's some have a 2 week notice, some have a 10-day notice that you have to give before canceling services. So you do want to keep that in mind too, that's a question you're asking. So then you're not locked into paying for 2 weeks of service if this truly is once a month, or once while you're looking for an assisted living, or something to that sort. If it truly is just temporary respite care and you're not looking for anything long term, that's something you want to look into.
Thank you. I have another question. What if I remember talking with someone, excuse me, whose husband had dementia, and he would get up in the middle of the night and want to wander out of the house, and she would not always wake up. He would
Mm-hmm.
wake her up. Would you go in at 2 o'clock in the morning for 3 hours or whatever time that person needed?
So
Just
our
to sit
agency would
there.
not.
Pardon?
Our agency would not go in there for that length of time, and I'm not aware of any agency that would do kind of middle of the night service like that. Typically, if it is, somebody who's a little bit of a wanderer, especially at night, um, it's a consecutive like 12-hour shift overnight for the safety, particularly of our staff. Regardless of what neighborhood you live in, how safe it is, going into somebody's house at 2 a.m. or pulling in a neighborhood, getting out of your car, especially now with the weather changing, it not being as light for as long. That's something that we kind of limit with what times and what things we can do. But typically, and this isn't all across the board, if overnight help is something you were wanting, needing, looking into, you would want to ask if this is an awake shift, because not all agencies have staff who stay awake all night. Sometimes if you want overnight service, you have to guarantee that the caregiver has 4 hours of uninterrupted sleep. Or I think there might be an additional charge for it or something like that. So you definitely want to ask those questions too. I don't think there's a ton of agencies that do that, but that is something that, folks look into. So if you do have somebody who's maybe a little more agitated or, looking for exits in the middle of the night, you'd want to make sure that whoever you hire is awake. Their staff is going to stay awake. They're going to be vigilant. They're going to, help redirect, engage your loved one to try and deter them from wanting to be outside in the middle of the night.
And for your own comfort, if you were to, and I'm speaking just of respite care right now, well, I guess any in-home care, do you background check your staff so that if I'm leaving my house with my dementia conditioned husband, someone's not coming in and taking my diamond tiara?
Yes. So, you want to also ask that question. I know most, if not all, licensed home care agencies do run background checks, do reference checks. They check to make sure that their employees have not been reported and or found to be reported to Colorado State's Adult Protective Services, to ensure that the person you're going to, have in your home is a safe, well-trained, knowledgeable individual. But also most reputable companies too are also licensed, bonded, and insured for extra safety, because at the end of the day, everyone is human. You can trust somebody as much as you can trust somebody until you can't anymore. But those are really good questions to ask. And the first one always is, are you a licensed agency? Because in the state of Colorado, not every home care agency has to be licensed. So if they are not licensed, there is no oversight by the state. There is no way to file a complaint about the agency. There is no way to ensure the state requirement standards are being met if they are not licensed. So that's the first question you always want to ask. And then ask if they are bonded and insured, just for your safety. If they cover workman's comp, say one of the care staff is, carrying laundry in a basket down the stairs and they trip and fall. Is the company going to take care of that? Or is the caregiver going to come after you as the individual, as the homeowner, for workman's comp liability?
Those are interesting aspects that a lot of us might not have thought of.
Yeah. And there's care.com, there's Facebook, there's all sorts of ways you can find caregivers. but not, again, yes, they're probably cheaper than going through an agency, but the chances of them being licensed are a little bit less, of them having their own insurance, um, that sort of stuff, the chances are less. So, there is a risk you can be taking by hiring an individual directly as opposed to an agency. Um, and at the end of the day, everybody's, you got to make the best decision for yourself in regard to, all the things that play into care. But those are just things you'll want to ask, regardless of who you're hiring. And, you know, my suggestion is to always, if you can, plan ahead. I would say chat with, 2 to 3 different home care agencies, because, all the tasks they can provide are the same. But the folks they send obviously aren't going to be the same. And, you might get a better feel from one person to another. And it truly is about, who's going to, fit your home, fit your loved one's home the best, and, that you want to see give the best care.
Well, and that's, again, I'm going to pitch H-Wise. We put every provider through a very rigorous vetting process, checking their license and all the credentials they need. So you're
Yes.
always safe when you come to H-Wise and find a couple of people to interview, I guess is what you do.
Yeah, exactly. So going to AgeWise, finding the non-medical home care folks, and calling 2 or 3 of them and having a conversation, or even having them out to your home. Most home care agencies, they will come to your home and do a free consultation, have a conversation, really talk about who they can send, how they can give the care. Um, but not all agencies home consultations are free either. So that's something, if you do start inviting people to your home beforehand, you want to, ask, hey, is this going to charge me anything? Is this free? And just so you're ahead of time. So, once that phone call's over, you don't owe them $100 for just answering your questions kind of situation. So, and what I tell everyone, no matter who I'm talking to, where I'm talking to them, you as the consumer have the right to choose who you use for any service. If your next door neighbor suggests somebody and you kind of go with them and they don't meet your needs, whatever that is, if that is, standards of care, if that is personality, you have the right as a consumer paying for these services to say, hey, I don't want this person back in my home, or you have the right to fire them and find a new company who you feel will fit you better. So never feel like you're stuck with one company, one agency. And this is across the board in regard to care. So please advocate for your loved ones as much as you can. Advocate for yourselves as much as you can. And I know sometimes it's really hard, to have those conversations and to, fear that you might be hurting someone's feelings, or, there's retaliation or anything like that. But that's one thing I can't stress enough. You all have choices in all these decisions you make. And, please speak up, find somebody who can help you, speak up if you're having trouble. And you should feel comfortable with whoever's in your home doing whatever, the care is.
Thank you.
Any other questions?
I don't see any others in the chat, so thank you so much, Katie. And I think we'll just go ahead and move on to Derek. Thank you for joining us, Derek. I know we were going to have someone else, and they had an emergency that they had to take care of with a client. And Derek Williams has graciously stepped in for us And I think you'll be excited to hear some of the innovations that his organization provides for you. So, Derek, I turn it over to you.
Sure. Thank you, Barbara. And Katie, hi. I like that profile picture. It's nice. Good morning. My name is Derek. As Barbara said, I am currently in the Thornton Trailwinds Active Adult Center. I was teaching a class on matter of balance. So finished that up and jumped right into this. So I am the owner of Comfort Care Home Care of Northeast Denver. And just like Katie's agency is a non-medical home care agency. And we provide all of the same things that Katie mentioned, and also bonded, insured, all of those things. I also provide care to the Medicaid population. And then my agency is built on the three strong beliefs. The first one is that if anybody falls, they should have help on the way within 5 minutes. And if they go to the hospital, they should not go back to the hospital once they return home for 3 months. And then finally, any primary caregiver of somebody should never ever burn out. And so that's really where respite care can fall and be an important thing. So this is right in line with what my agency is built to do. And so the way I do that is to help with uh, in-person care, like Katie talked about. And then also I have a series of remote supports, specifically fall detectors, wellness monitoring, chronic disease monitoring, and remote caregiving that can be utilized both on a private pay basis as well as through Medicaid to accomplish those. Um, so the fall detectors that I employ are a little bit different than what you may be familiar with Life Alert, where there's a button that you can push. Mine are active radars that sit on the wall and are always on. And then if somebody does fall, it will pick that up. And within 3 minutes, 3 to 5 minutes, it will alert a remote care coordinator team who can activate a phone tree to find someone to come and get this person up off of the floor. Um, the benefit of this system is that it is always on and nobody has to remember to wear anything, and they don't have to be conscious or able to push a button in order for help to be on the way. Um, and then wellness monitoring is a series of motion sensors that learns normal behavior. And there's also door sensors that fit on the doors to outside of the home. And so let's say someone is a dementia risk or an eloping risk, which means that they're at risk of leaving the home in the middle of the night, say, like that case that Barbara brought up. These sensors will pick that up, and then if there is unusual activity, the remote care coordinator team is alerted, and they can reach out to somebody to come collect that person if they leave the home or if they're doing something. But it can also be used to notice medical changes. So say they're using the restroom more frequently, it could be indicative of something like a urinary tract infection. So if they have dementia, they may not know or notice that they're using the bathroom more often. So this system will pick that up. Remote caregiver really is all of the things a caregiver can do that doesn't need to be done in person. Um, so things like medication reminders, prompting, companionship, group settings, that type of thing. It's a really great service. Daily check-ins. It's a very common one that's being used by my system. Is the remote care coordinator team can check in with people on a daily basis and free the family up for a little peace of mind, and also not have to worry about that while they're on vacation or if they have a busy work or social life, something like that. And then chronic disease management is much like remote caregiver, only they get a tablet with pulse oximeter, blood pressure cuff, and a scale. And if they return home from the hospital, usually they're at higher risk of returning to the hospital within 3 months. And so if their vitals change, this will pick that up and we can head off or return to the hospital and reduce rehospitalization by as much as 90%. So a lot of really powerful solutions that technology can provide that can make can be used in coordination with in-person caregiving to make care more affordable. Um, if you want to learn more, I can go into more depth about it. I do have a webinar that you're welcome to join. So, hey, Katie. Yeah,
Sorry, there was a question in the chat, and then I had a question for you, Derek.
sure.
Paul wants to know what's the typical cost per hour varying from companionship to care? Are there agencies that provide respite care free of cost? Do you want to take that, Derek, real quick?
Sure. So let's see. Typical cost. Um, it doesn't usually vary if it's companionship or more higher levels of care when you're talking about non-medical. Um, and it's usually right around $40 an hour is kind of what I see. It does go up from there if you're looking at a shorter shift, like a 2 or a 1 hour shift. Um, as far as respite care free of cost, the answer is it depends. Um, depends on if you qualify. You can call Dr. Cog, right, Barbara? And they might have some programs that you could qualify for. So certainly do that. And the AAA, the local area on aging in Denver can do that. And then there's also a program through traditional Medicare. So if somebody has traditional Medicare A and B, there's a program called Guide. And if the owner of the insurance plan has been diagnosed with dementia, their primary caregiver can get respite care paid for by Medicare. Um, but again, they need traditional Medicare. If they have a Medicare Advantage plan that's administered by like United or Cigna or anybody else, that usually doesn't work for them. Am I missing anything?
Over the last 4+ years that I've been, you know, talking to so many providers, other than what you've mentioned, I don't see any free services particularly. Sometimes I think depending on the condition of the person, um, another family member, or a neighbor or something might come in for a brief period of time when it's not a serious condition, but you are the best judge of, what your person that you're taking care of might need while you're gone. And having a professional be there is worth the investment of that cost, whatever it may be, to give you the peace of mind that while you're gone, they're safe.
Derek, with the electronic remote monitoring, do you guys provide the equipment?
Yeah, great question. Yes, I do. So they would contract with me and then I would provide it directly to them, depending on what they need.
And is
Yep.
it like a pretty easy setup? Like you plug in, do they need Wi-Fi?
Good question. So fall detectors need Wi-Fi. And if you don't have Wi-Fi, we can arrange something. And then wellness monitoring requires that have a local area network plug-in, but all Wi-Fi routers have one of those. So if you have Wi-Fi, you have that. And then chronic disease management and um, remote caregiver. Well, remote caregiver can be done either through the phone, through an app on your smartphone, or I could provide a tablet with the app on it. Wellness monitoring comes with a tablet. The tablet is Bluetooth connected with a pulse oximeter, a blood pressure cuff, and the scale. Those automatically, when you do those readings, sync with the app on the tablet, and then that's synced with the remote care coordinator team.
And
So
then,
you need Wi-Fi for that.
okay, sorry, I'm full of questions, so I hope this is answering some questions people weren't thinking about. With the fall detection one, you said there, it triggers like the triage team to start, calling around, seeing, who's available. Typically, like, what's the time between you guys being alerted there's a fall to somebody like really being at their door?
It it really depends on where those people are. So um, largely this is being used at the moment um, in communities. So they'll fall in the community, and then within minutes, somebody's at their door. And then it depends if it's out in the community. Let's say someone's at home. It depends on who's on that call list.
Okay.
If it's a neighbor, uh, somebody could be there within minutes. If it's a family member or something that lives a little whiles away, then um,
Okay, so
it can increase from there. Yeah,
so it's not one of your staff who's on call to go make sure this person's okay.
yeah. It's a good question. No one at this time, but we can do that if we need to. Yeah,
Okay, okay. I think I was a little confused there, but thank you.
yeah. Good question. Yeah.
I would ask with the using all these different sensors, is that something that would permit the caregiver to leave for, again, probably not super serious condition, like a dementia person, going out and wandering the streets. But could they go do a part-time job or, um, feel more
Yeah.
confident if mom's just starting or dad's just starting or your spouse to not be functioning as they used to. This might be a good precautionary thing as their conditions progress.
Yeah, absolutely. I'm actually going to do an installation this week for a woman that gets 7 hours of care during the day from 11 to 6. And then we're installing the fall detectors because she's alone from 6 to 11. And then the remote caregiver is going to call her when she wakes up at 8:30 or 9 in the morning. So it's a way that we can balance the best of all worlds and make it much more affordable than putting a caregiver in there for 12 or 24 hours a day. Yeah.
Great.
Yeah, Katie, you're on mute. You're on mute.
Katie, you're muted.
And I just keep talking, so it's okay. Um, with all of these remote monitoring, do you build it into, is it a monthly cost? It is a like per usage cost?
Um, it's a good question. Uh, it's a monthly cost if they are not getting care. If they're getting in-person care, then I roll fall detection in, and then the other three services are monthly. Yep. So we have, so for example, I have clients that just use fall detection, so they pay for that, and that's it. I have other clients that I'm providing in-person care for that are fall risk, and I just roll that into the cost of the hourly care that we provide. And then with Medicaid, they have a special program just for remote supports.
So this, even if you didn't need a person right now, um, I'm thinking of cost effectiveness for being able, for the caregiver to be able to continue to live their life kind of like they always did. But knowing again that their loved one is safe, ultimately bringing an a person in from a home care agency as things progress if they needed that.
Yeah, that is kind of the ideal situation. Usually it's the other way around. Usually it's a tipping point event where something happened, like they fell, they went to the hospital, they had an emergency where they can't, for a short period of time, do some activities of daily living on their own until they go through rehab and get stronger and are able to live on their own. And so another agency or mine will provide the in-person care, but then they can, they might be able to decrease hours of in-person care. And um, then at that point, the virtual care is available until another event happens. And then you bring care in and then kind of oscillate back and forth. Yeah. Usually there usually something bad happened that kind of pushed them into this situation. Yeah. I
Well,
think Katie can back that up too.
yeah, I see this as a way for more people to get the care they need or the watch that they need without having to hire someone. You know, I know for all of us that are in the field, funding has gotten very tied up and it's a lot less than it used to be. And for those that can do this with an incident, they can get the services they need when they need them.
Yep. Yep.
The
I so I mean the technology is good for some peace of mind, but there really isn't a replacement for professional care,
absolutely.
especially people that do this for a living, and great teams like Katie's that can come in and be the hands-on and the eyes in the room. I know my agency, and I know Katie does this a lot, is like safety assessments and stuff like that. It's kind of like the frog jumping into a pot of hot water. We come in and see a really bad situation and go, you need this, 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 and this. And the family's like, oh, I had no idea,
Right.
type of thing. So that's really the benefit of in-person care, which is why usually there's an event that happens, in-person care is established, and then the technology is brought in to support from there. Yeah.
I
Yeah,
do.
nothing will ever replace human care, I don't think.
Yeah. Yeah.
I do think, though, kind of to your point earlier, Barbara, some of these technologies are, good supports to have, especially for maybe somebody who's not quite advanced in, their care or their cognition decline, and truly, truly more cost effective. Because once you hit, we've done the math, about 6 to 8 hours of care daily, 7 days a week, is the average cost of assisted living, not including care in assisted living. But truthfully, once you hit 12 hours or 24 hours with home care, a physical person in your home, the cost is quite up there,
Yeah.
truthfully. So
Right.
Yeah.
you have to weigh that and cost effectiveness with care and that sort of thing. So
I want to thank everyone for attending. Thank you, Katie and Derek, for all the great information. We really appreciate it.